Thank you all on this lovely Sunday morning to come here and help us to inaugurate and have the first endocrine update by our society. Our society has been recently formed. The society is called as Therapy and Research in Endocrinology and Diabetes Society, DiaPlus Friends Society. We have our secretary, Dr. Praveen Ramchandra. Just to start, look at this particular man. I hail from Gujarat. So whenever we start, we look at this gentleman. This is Mahatma Gandhi. And you find this picture or a statue of Mahatma Gandhi everywhere. Starting from your pocket to most of the part of the world, you will find this. And very important thing is that the statue of Mahatma Gandhi has been put in most of the places. This is somewhere near the UK Parliament. It is there in US Parliament. And what it has been mentioned in one sentence below, it is not like MK Gandhi or Mahatma Gandhi. The one sentence that is mentioned below this picture is, one man can change the world. So for all the doctors who have been treating endocrinology or who have been treating diabetes, it is very, very important for them that they are the one person who can change the life of their patient. They have not seen Mahatma Gandhi, they have not seen Mother Teresa. They have seen you and they find that you can change their life. And how best we can change their life? Most important part is to have the adequate knowledge about the disease which can help them to change the course of disease. This is a map of the world which has been taken from the satellite. And in this map, typically what you find over here is, you find there are certain areas which are quite bright, and India is one of those bright areas you can see over here. This bright area suggests urbanization of these particular countries. And this urbanization is straight away related to increased incidence of diabetes. And these are the top 10 countries where the incidence of diabetes is quite high. India is in the race to come number 1 in terms of diabetes, and the expected amount of diabetes by 2030, which is a WHO projected figure, suggests it is going to be around 79 million people would have diabetes. So it is quite a serious thing to understand and start preventive measure from now onward. Typically, if you have a healthy habit, reduce the risk factor, pre-diabetic, we go into diabetes state and chronic acute complication and chronic complication. So if we stick on with this healthy habits, probably we are not going to get problem to great extent. So right now the need of the time is to educate people about diabetes, their relatives. They require a comprehensive kind of care, affordable quality care, a lot of screening camps are required, a lot of mass media awareness is required, and involvement of government and NGO is required. Once again, it was very important that this year the theme of the World Health Day was beat the diabetes. Not beat the diabetic patient, but beat the diabetes. So what is required is commitment needs to be undertaken, and in that we have formed this society, that is DiaPlus Friends Society, with the aims and objective to spread the awareness about diabetes in patients and practitioners, to create a database to study prevalence of various endocrine disorders, to provide cost-effective and affordable diabetic endocrine care across the country, and to take up research protocol to simplify the management of common endocrine problems. We have 8 DiaPlus clinics all over the country, which includes Ahmedabad, Bangalore, Berhampur, Chennai, Gulbarga, Hyderabad, Indore and Salem. And all the centers are run by qualified endocrinologists. The USP is that we follow a standard protocol and we have ethical practice in treating all those endocrine cases. Today in this endocrine update, we are going to have variety of topics, and these are the less frequently discussed topic in routine CMEs. We are going to have a detailed kind of interaction, and the important part would be the endocrine quiz to stimulate the student and PGs related to endocrine. So it's very important. Malala, who is a Nobel Prize winner, who has given a very good statement that is one child, one teacher, one book and one pen can change the world. So when we can come together, probably we can learn more and treat better way and we can change the world. A very important message I read today morning, that is drop of rain. That is very tiny molecule of water, but a continuous pour of such tiny drops can change the flow of river. So this is a very small and humble beginning to start with such kind of a CME program, but such kind of more CME program probably can teach more practitioners and probably we can change the routine diabetic care in our country. Thank you.